What are coronaviruses? Coronaviruses are a large family of viruses that can make humans and animals sick. They cause illnesses that can range from the common cold to more severe diseases. In early 2020, a new virus began generating headlines all over the world because of the unprecedented speed of its transmission. It is caused by a member of the coronavirus family that has never been encountered before. How did the outbreak start? The source of the coronavirus is believed to be a wet market in Wuhan, which sold both dead and live animals, including fish and birds. What causes coronaviruses? Coronaviruses are zoonotic. This means they first develop in animals before developing in humans. For the virus to pass from animal to humans, a person has to come into close contact with an animal that carries the infection. Once the virus develops in people, coronavirus can be spread from person to person through respiratory droplets. This is a technical name for the wet stuff that moves through the air when you cough or sneeze. Who is at increased risk? You're at high risk for contracting if you come into contact with someone who's carrying it, especially if you've been exposed to their saliva or been near them when they've coughed or sneezed. What treatments are available? There's currently no treatment specifically approved for COVID-19 and no cure for an infection, although treatments and vaccines are currently under study. Instead, treatment focuses on managing symptoms as the virus runs its course. How to prevent coronavirus? The best way to prevent the spread of infection is to avoid or limit contact with people who are showing symptoms of COVID-19 or any respiratory infection. The next best thing you can do is practice good hygiene to prevent bacteria and viruses from spreading. The virus is thought to spread mainly from person to person. The virus can cause pneumonia. Those who have fallen ill are reported to suffer coughs, fever and breathing difficulties. In severe cases there can be organ failure. As this is viral pneumonia, antibiotics are of no use. The antiviral drugs we have against flu will not work. Recovery depends on the strength of the immune system. Many of those who have died were already in poor health. There is currently no vaccine to prevent coronavirus disease. The best way to prevent illness is to avoid being exposed to this virus. How to isolate yourself? Do not go to public places, such as work, school, shopping centers, childcare, or university. If possible, ask other people to get food and other necessities for you and leave them at your front door. Only people who usually live with you should be in your home. Do not let in visitors. You do not need to wear a mask in your home. If you need to leave home to seek medical attention, wear a surgical mask, if you have one, to protect others. How it spreads? There is evidence that the virus spreads from person to person. The virus is most likely spread through close contact with an infectious person, contact with droplets from an infected person's cough or sneeze, touching objects or surfaces, like doorknobs or tables, that have cough or sneeze droplets from an infected person, and then touching your mouth or face. What are the prevention tips? Wash your hands frequently for at least 20 seconds at a time with warm water and soap. How long is 20 seconds? Don't touch your face, eyes, nose, or mouth when your hands are dirty. Don't go out if you're feeling sick or have any cold or flu symptoms. Stay at least 3 feet away from anyone who is coughing or sneezing. Cover your mouth with the inside of your elbow whenever you sneeze or cough. Throw away any tissues you use right away. Clean any objects you touch a lot. Use disinfectants on objects like phones, computers, utensils, dishware, and doorknobs. Surgical masks in the community are only helpful in preventing people who have coronavirus disease from spreading it to others. If you are well, you do not need to wear a surgical mask, as there is little evidence supporting the widespread use of surgical masks in healthy people to prevent transmission in public.